After 80, elderly health problems don't begin with something dramatic.
Yeah.
They begin with something small, something most people would ignore.
And the truth is, these aging body changes don't ask for permission before they take control.
Doctor, she was fine just a couple days ago. It was just a cold. How did we end up here? That question stays with you because I hear it all the time.
Mrs. Eleanor Brooks, 82 years old, walked into my clinic like she had done dozens of times before. Calm, independent, no urgency, no fear, just a simple concern. She looked at me and said, "Dr. Reeves, I think I caught something, just feeling a little tired, maybe a cold." Now, if you're in your 40s, that sentence means very little. If you're in your 60s, maybe you rest a bit longer. But after 80, that sentence can mean everything. And this is where most families misunderstand aging body changes. They think health declines in big, obvious moments. A heart attack, a stroke, a diagnosis. But that's not how it happens. It happens quietly. It happens in ways that feel normal. It happens in ways people dismiss as just getting older. I checked her vitals. Nothing extreme. Slight changes, subtle shifts. The kind that don't alarm most people. But they should. Because when you've worked in senior healthcare long enough, you start to recognize a pattern that most people never see. It's not the symptom that worries you. It's what the symptom is sitting on top of. I asked her something very simple. Have you felt more tired lately, even before this? She hesitated. Maybe. I thought it was just age. That answer tells me more than any lab test. Because elderly health problems don't show up overnight. They build slowly, quietly, under the surface, layer by layer, until one small thing pushes the body too far. I told her to go home, rest, drink fluids, watch her breathing carefully. 48 hours later, she wasn't in her home. She was in a hospital bed. Oxygen dropping, confusion beginning, infection spreading faster than her body could control. And her daughter stood outside that room, repeating the same words over and over again. But it was just a cold. It was just a cold. And this is the part that most people don't understand. It was never just the cold. I've seen this exact situation more times than I can count. And it's never just the cold. Because after 80, aging body changes alter the way your body responds to everything. Not just illness. Everything. Your body doesn't react the way it used to. It doesn't recover the way it used to. And most importantly, it doesn't warn you the way it used to. That's the real danger. Before we go any further, I want you to do something simple. Drop a comment right now with just your age. Just your age, nothing else. I want to see who's watching this because what I'm about to explain applies very differently depending on whether you're 65, 75, or 85. And if you've ever felt even slightly dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. That matters more than you think. And in about 3 minutes, you'll understand exactly why. And if you care about staying independent as you age, not just living longer, but living safer, make sure you subscribe. Because this channel is about giving you the knowledge to protect yourself, prevent avoidable health risks, and stay in control of your life as you get older. Now, let's continue the story. At 50, your body fights back fast. At 70, it slows down a little. But after 80, something shifts in a way most people are never prepared for. The body is still working, but it's working differently. Slower, less precise, sometimes too late. And when that happens, something small, like a mild infection, can trigger something much bigger, a chain reaction. And to understand what really happened to Mrs. Brooks, we have to start with the first change that almost nobody takes seriously until it's already too late. And to understand what really happened to Mrs. Brooks, we have to start with the first change that almost nobody takes seriously until it's already too late: your immune system. Now, most people think of the immune system in very simple terms: strong or weak, good or bad. But after 80, that's not what happens. It doesn't just get weaker, it changes. There's a medical term for this, immunosenescence. And it's one of the most overlooked causes of elderly health problems in America today. Because here's the truth about aging body changes that most families never hear. Your immune system doesn't just lose strength. It loses precision. It becomes slower to respond, less accurate in how it fights. And sometimes, it reacts too late to matter. That's exactly what happened to Mrs. Brooks. What started as a mild cold didn't stay mild. Not because the virus was aggressive, but because her body didn't respond the way it used to. At 50, your immune system detects a threat and reacts quickly. At 70, it might take a little longer. But after 80, that delay becomes dangerous, because your body is no longer producing immune cells at the same rate. Fewer new defenders, slower communication between cells, and a response that often arrives after the infection has already spread. But it gets worse, because the immune system doesn't just slow down, it becomes disorganized. Sometimes it overreacts, causing unnecessary inflammation. Other times it underreacts, allowing infections to take hold. And that imbalance is what turns something small into something life-threatening. Mrs. Brooks didn't collapse because of a cold. She declined because her body couldn't contain what used to be manageable. And this is where elderly health problems become unpredictable. A simple infection becomes pneumonia. A mild urinary tract infection becomes confusion, even delirium. Families think it's sudden. Doctors know it's been building. Here's the part that should concern you. In adults over 80, pneumonia is one of the leading causes of death. Not heart disease, not cancer, a respiratory infection. And urinary tract infections, something most younger people recover from easily, can trigger severe cognitive symptoms in older adults. Memory loss, disorientation, sudden behavioral changes. These are not separate problems. They are all connected to aging body changes in the immune system, and most people never see it coming. Because it doesn't feel like a warning. It feels like a normal day. Until it isn't. That's why I say this to every patient over 80. At 80, your body doesn't fight harder. It fights differently. And often too late. Now, the good news is this. Even though we cannot stop these aging body changes completely, we can slow them down, and in some cases, reduce their impact significantly. This is where senior health care becomes critical. And it starts with 3 things that sound simple, but make a measurable difference. First, vaccination, flu shots, pneumonia vaccines, shingles vaccines. These are not optional at this stage of life. They are protection layers your body can no longer build efficiently on its own. Second, nutrition. Your immune system depends on it. Vitamin D, vitamin C, zinc, and most importantly, adequate protein. Because without the right building blocks, your body cannot produce the cells it needs to defend itself. And yet, one of the most common elderly health problems I see is undernutrition. People simply aren't eating enough to support their immune function. Third, movement. Not intense exercise. Not anything extreme. Just consistent daily movement. Walking, light stretching, staying active. Because physical activity improves circulation, and circulation is how your immune system moves through your body to do its job. These are not complicated longevity habits, but they are the difference between resilience and vulnerability. And here's what most people don't realize. When the immune system starts to fail, it doesn't stay isolated. It triggers the next change, the one that makes even simple movements dangerous and turns everyday situations into real risks. And here's what most people don't realize. When the immune system starts to fail, it doesn't stay isolated. It triggers the next change, the one that makes even simple movements dangerous and turns everyday situations into real risks. Loss of balance. Now, I want to tell you about someone else. Mr. Robert Hayes, 84 years old. Strong man, former construction worker, lived alone just outside Phoenix. Still did his own repairs, still organized his own garage, still believed he was doing just fine. That's what he told me. I'm slowing down a little, Doc, but I'm still good. Until one morning, he wasn't. He walked into his garage to grab a box from a lower shelf. Something he had done 100 times before. No rush, no distraction, no slippery floor. He bent down, reached forward, and the next thing he remembers is waking up on the ground. Hip fractured, unable to stand, no warning. And when I asked him what happened, he said something I hear all the time. I don't know. I just lost my balance. That sentence sounds simple, but it tells me everything. Because falls like this are one of the most common and most misunderstood elderly health problems in the United States. People call them accidents. But they're not accidents, they're system failures. After 80, aging body changes begin to affect multiple systems at the same time. Your inner ear, the vestibular system that controls your sense of balance, becomes less sensitive. Your vision, which helps you orient yourself in space, becomes less reliable. And your muscles, already weakened by aging and muscle loss, can't react fast enough to correct even a small shift. So what looks like a simple misstep is actually a breakdown in coordination between your brain, your eyes, your inner ear, and your muscles. That's not bad luck. That's biology. And this is where the danger escalates, because once balance is compromised, everything changes. You walk more carefully, you move more slowly, you become less confident. And that hesitation, combined with weakened reflexes, actually increases your risk even more. Here's the statistic that should get your attention. Falls are the #1 cause of injury-related hospital admissions among older adults in America. Not car accidents, not major illnesses. Falls. And for people over 80, the consequences are rarely minor. Broken hips, head injuries, permanent loss of independence. This is how a normal day becomes a life-changing event. And it often happens without warning. That's why I tell my patients this very clearly. Falls don't happen because of the floor. They happen because your body stopped knowing where it is. Now, the good news is this. Unlike many aging body changes, balance is something you can actively improve. And this is where simple senior healthcare strategies can make a powerful difference. First, balance training. You don't need a gym. You don't need equipment. Standing on one foot while holding onto a chair. Walking heel to toe in a straight line. Tai Chi. Gentle yoga. These movements retrain your brain and your body to work together again. Second, your environment. Look around your home. Loose rugs. Poor lighting. Cluttered pathways. These are small things, but in the context of elderly health problems, they become serious risks. Fix them now, not after a fall. Third, medication review. This is one of the most overlooked factors in senior health care. Blood pressure medications, sleep aids, certain antidepressants, they can cause dizziness, delayed reactions, or instability. If you feel even slightly unsteady, that is not something to ignore. That is a signal. And signals matter. Because here's the reality. Loss of balance is not just about falling. It's about losing confidence in your own body. And once that confidence starts to go, it leads directly into the next change, the one that most people fear the most, but often misunderstand completely. And once that confidence starts to go, it leads directly into the next change, the one that most people fear the most, but often misunderstand completely, the brain. Now, let me take you back to Mrs. Brooks. A few weeks before she ended up in the hospital, she told me something quietly, almost like she didn't want to say it out loud. "Dr. Reeves, I forgot my grandson's name the other day." She looked embarrassed, worried. "I've never done that before. Is this how it starts?" That question carries a lot of weight, because when people think about aging body changes, this is the one that scares them the most. Memory, Alzheimer's, losing control of their own mind. But here's what most people get wrong, and it's one of the biggest misunderstandings in elderly health problems today. Not every memory issue is dementia. Not even close. After 80, it is completely normal for the brain to slow down. Not stop, not fail, slow down. It may take longer to find the right word, longer to recall a name, longer to process information. That's not disease. That's aging. And in senior health care, this distinction matters more than most people realize. Because fear leads people to the wrong conclusions, and the wrong conclusions lead to the wrong behaviors. Mrs. Brooks wasn't losing her memory. Her brain was processing information more slowly. That's a critical difference, because slower processing does not mean permanent damage. It means reduced efficiency. But here's where things become serious, because while normal aging affects speed, there is a line. And after age 85, that line becomes much easier to cross. Studies in the United States show that roughly 1 in 3 adults over 85 will develop some form of dementia. That's not a small number. That's a reality we cannot ignore when we talk about aging body changes and long-term brain health. And here's what accelerates that decline faster than anything else. Isolation, lack of stimulation, poor sleep. I see it all the time. Patients who stop going out, stop meeting friends, stop engaging in conversation. They sit in front of a television for hours, days, weeks. And slowly, without realizing it, their brain begins to disengage. Because the brain is not like a muscle that simply weakens. It adapts to how you use it, or how you don't. This is why understanding how to prevent dementia is not about one single solution. It's about daily behavior. Because brain health in seniors is not maintained by medication alone. It's maintained by activity, conversation, challenge. And this is where the message becomes very clear. The brain doesn't die suddenly. It fades faster when it's not used. That's not a theory. That's what I see in real patients. Every single day. Now, the good news is this. There are practical, proven ways to slow this process, and in some cases, significantly delay cognitive decline. This is where senior healthcare and longevity habits come together. First, social connection. Regular conversations, time with family, community involvement. These are not optional luxuries. They are protective factors for your brain. Second, mental stimulation. Reading, learning something new, even simple things like puzzles or games. These activities create new neural pathways, something your brain needs more than ever after 80. Third, sleep. And this is the one most people underestimate. During deep sleep, your brain clears out waste products, including proteins associated with Alzheimer's disease. Without proper sleep, those proteins accumulate, and over time, that increases your risk of dementia. This is why just getting older is never the full explanation, because when you look closely at elderly health problems related to memory, you often find patterns, and patterns can be changed, but only if you recognize them early. Because once the brain starts to decline beyond a certain point, the next change begins. And once the brain starts to decline beyond a certain point, the next change begins, and it doesn't affect just your thoughts. It affects your ability to move, to function, and to stay independent. Your muscles. Now, I want you to picture something very simple. A chair. Not a heavy object, not a difficult task. Just standing up from a chair. I had a patient, 78 when I first met him, 82 when this happened. He sat down in my office like he always did. We talked. Everything seemed normal. And then, when the visit was over, he tried to stand up. He leaned forward, pressed his hands against the armrest, paused, tried again, and then he looked at me and said something I will never forget. "Doc, I don't think I can get up." That moment changes everything. Because when we talk about elderly health problems, people often focus on disease. But this is where independence starts to disappear. Not being able to stand up, not being able to walk safely, not being able to carry your own body. And this is directly connected to aging body changes that most people underestimate. It's called sarcopenia, age-related muscle loss. And unlike what most people believe, it doesn't happen slowly forever. After 80, it accelerates significantly. Muscle mass doesn't just decline, it drops at a rate your body cannot easily recover from. Strength decreases, reaction time slows, balance becomes harder to maintain, and suddenly, everyday movements become difficult. Getting out of bed, climbing stairs, standing up from a chair. These are not just inconveniences, they are survival functions. And when they begin to fail, the consequences come quickly. Because here's the reality. If you cannot stand up on your own, you cannot live on your own. That's why I say this very clearly to my patients. Not being able to stand up is the beginning of losing your life, not just your strength. That's not dramatic. That's clinical reality. And it's one of the most critical aging body changes we see in senior health care. Now, here's what makes this even more dangerous. Muscle loss feeds into everything we've already talked about. Weaker muscles mean poorer balance. Poorer balance means higher fall risk. Falls lead to injuries, and injuries accelerate decline. It's a chain reaction, and once it starts, it's very hard to stop. But here's the part most people don't hear often enough. Muscle loss is not completely inevitable. Yes, it happens. But how fast it happens, and how severe it becomes, depends largely on your daily habits. This is where simple longevity habits can make a measurable difference. First, resistance training. And I'm not talking about heavy lifting. I'm talking about consistent, controlled movement. Chair squats, resistance bands, light weights, even body weight exercises. These stimulate your muscles to maintain strength. Second, protein intake. This is one of the most overlooked factors in elderly health problems. Your muscles cannot maintain themselves without adequate protein. And yet, many older adults are not getting enough. You should aim for consistent protein intake throughout the day, not just one meal, because your body needs a steady supply to repair and maintain muscle tissue. Third, daily movement. Not intense workouts, simple, consistent activity. Walking, standing, moving. Because inactivity accelerates muscle loss faster than almost anything else. Your body adapts to what you do, or what you stop doing. And this is where everything connects. Because once muscle loss progresses beyond a certain point, it sets the stage for the next, and often most underestimated change. The one that turns a simple fall into something much more dangerous. Your bones. Now, let me tell you about a patient I saw in Florida. 82 years old. Lived near Tampa. Still active, still independent. Still believed she was careful enough. She didn't fall down the stairs. She didn't slip on ice. She simply lost her footing while turning in her kitchen. A small misstep. A minor loss of balance. The kind of thing most people would brush off. But she didn't brush it off. Because when she hit the ground, she couldn't get back up. Hip fracture. And everything changed from that moment forward. This is how many elderly health problems unfold, not with major trauma, but with something small that the body can no longer withstand. Because after 80, aging body changes don't just affect your muscles or your balance. They change the structure of your bones. This is osteoporosis. And it's not just about bones becoming thinner. It's about bones becoming weaker from the inside out. The internal framework, the part that gives bones their strength, begins to break down. It becomes porous, fragile, unstable. So when impact happens, even a minor one, the bone cannot absorb the force the way it used to. And that's what makes this so dangerous. Because the fall isn't the real problem. It's what the body can no longer survive after the fall. Here's the statistic that most people don't expect. In adults over 80, a hip fracture carries a 20 to 30% mortality rate within the first year. Not from the fracture itself, but from what follows. Immobility, infections, blood clots, rapid decline in overall health. This is where everything we've talked about begins to connect. Weaker muscles increase fall risk. Poor balance leads to instability. And fragile bones make recovery far more difficult, if recovery happens at all. That's why I say this clearly to every patient. It's not the fall that kills, it's everything that comes after. Now here's the part that matters. Because while these aging body changes are real, they are not completely out of your control. This is where senior health care and long-term longevity habits play a critical role. First, calcium and vitamin D. Your bones require both to maintain strength. Without adequate levels, bone loss accelerates, And yet, many older adults are deficient, especially in vitamin D. Second, weight-bearing activity. Walking, standing, gentle resistance movements. These are not just exercises, they are signals to your body. They tell your bones to stay strong, because bones respond to stress by reinforcing themselves. If you stop moving, your body interprets that as a reason to weaken. Third, bone density testing. This is one of the most underutilized tools in senior health care. A simple scan can tell you exactly where you stand and whether intervention is needed. Waiting until a fracture happens is not a strategy. It's a consequence. And here's what I want you to understand. When people talk about healthy aging, they often focus on living longer. But what matters more is how you live. Because elderly health problems are not just about disease, they're about the loss of independence. And bone health is one of the final barriers between living independently and depending on someone else for the rest of your life. And once that barrier is broken, everything we've talked about becomes harder to manage. Which brings us to the most important part of this conversation, because none of these changes happen in isolation. They are connected. Your immune system weakens, your balance becomes unstable, your brain slows down, your muscles begin to disappear, your bones become fragile. These are not random events. These are aging body changes that follow a pattern. A predictable progression of elderly health problems that I see every single day in my practice. And here's the truth most people don't want to hear. None of these are optional, but how fast they take over your life is. That's the difference. Not whether they happen, but how quickly they happen. And more importantly, how much control you keep while they do. Because over the years, I've noticed something very clear in senior health care. There are two types of people after 80. The first group slowly gives up control. They move less. They isolate themselves. They stop challenging their body. They accept every change as just aging. And without realizing it, they accelerate every one of these problems. The second group does something different. They stay engaged, they stay active, they pay attention, they build simple, consistent longevity habits. Not extreme, not complicated, but consistent. And the difference between these two groups is not small. It's life-changing. I've seen patients in their late 80s and early 90s who still live independently. They walk without assistance. They hold conversations clearly. They manage their daily routines without help. And when people ask me, what's their secret? They expect me to say genetics. They expect me to say luck. But that's not what I tell them. Because I've treated those same patients for years. I've seen their habits, I've seen their decisions, and I can tell you this with absolute certainty. It's not luck, it's choices. Small choices made every single day. To move when it's easier to sit. To connect when it's easier to isolate. To take care of their body before something goes wrong, not after. That is what healthy aging actually looks like. And that is what most people misunderstand about elderly health problems. They think decline is something that suddenly happens, but decline is usually the result of accumulated neglect. And the opposite is also true. Stability, strength, independence. They are the result of accumulated care. So if you take one thing from this conversation, let it be this. Age is a number. Decline is a choice. Not a perfect choice. Not a guaranteed outcome, but a direction you control more than you think. So here's what I want you to do. Share this with someone who needs to hear it. A parent, a grandparent, a friend sitting right next to you. Because these are the risks that silently threaten the later years of life, and no one should face them unprepared. Because what you've heard today could help them avoid the most dangerous elderly health problems before they even begin. And if you're listening to me right now, start today. Not next year, not after something goes wrong. Today, because the earlier you respond to these aging body changes, the more control you keep. And in the end, that's what matters most. If this story resonated with you, please like this video, subscribe, and share it with someone who might need to hear it. Leave a comment below. What choice will define how you age? I'd love to read your thoughts. Because next time, I'll be sharing something most people never talk about. 9 warning signs in your feet. That could mean diabetes. Thank you for watching, and remember, your best years aren't behind you.